Dr. Emer, you're live.
Hey guys, it's Dr. Emer, and we're finishing up the day with one of our favorite treatments, female facial sculpting. And you guys know when you're thinner, you're athletic, you tend to lose a little bit of volume in the face. And I have a very beautiful, thin female here with me today who just loses volume and structure to her face because she exercises a lot and she has a very stressful, busy, high-profile life that makes her stressed out. So we keep her contour, we keep her looking natural using fillers. So come on close. So here's the thing. There's a couple of things. She really likes having a very straight, lifted tip of her nose. So we're going to do some nose contouring today, also known as liquid rhinoplasty. But one of the things I really like to do is keep her cheeks elevated, keep her chin kind of a little bit structured and elongated so we don't get any of that sagging in the jawline area, and then soften with the folds. So I'm going to use a little bit of Juvederm first, and I'm going to use this to just kind of lift a little bit in the trough. I'm just going to do a little bit to the apple of the cheek, nothing too crazy. This is Juvederm Ultra Plus. It's just going to give us a little structure to the apple of her cheek, so when she smiles, it has a nice highlight to it. I'm going all the way to bone. Just a little, because we already have some filler here from many months ago.
How long does Juvederm last?
I mean, but listen, and if you're in LA, HA fillers last about 6 months because people work out. One more. They work out, their metabolism is faster, they tend to metabolize the fillers. But if you look at the clinical trials, they'll tell you 9 to 12 months. Little pinch kind of on the chin. Just want to keep it structured. Right on the bone. Sorry, she's a really good sport. Again, one more pinch. Now for women, I tend to want to keep that heart-shaped look. So we don't go too wide. Perfect. I'm going to switch sides. And now look, when you have the elevation here and a little projection there, it gives you more of that heart-shaped look. Also, the support to the apple of the cheek supports the tear trough. So we're giving her a little volume.
How does the heart-shaped look help make the face look more feminine?
Well, women like to have what we call a wider midface and a more narrow, elongated lower face, which is also known as a heart-shaped look. That tends to be what's known as a sign of facial beauty in Western culture, okay? Some people outside the United States find that that's a little too feminine, and they like a little more round or a little more square. That's why if you look in Russia, for example, a lot of the women have more of a squared off face, and they have much larger cheeks, lips, and jaw. I'll give you that, that'll be fine. But I need, is the decon on a small one? Or is it a small one? What's a big one? Yes, we have that 30.
30, sorry.
Yep. So, in America, we like this area having a little more hollowing, this area more straight, this area more straight. And so, what I'm going to do, just bring it back just a teeny bit.
How's the pain level?
I feel almost nothing.
She's so strong. So one more. And I'll check the other side as well. Good. So let me see the other side now. Take a look, and you guys can see now much more of an elevation. And if you look from overhead, if you were actually to look, you can see much more of that contouring there and projection into her chin. So now I want to do a little definition of lips. She doesn't want volume. We just want to create shape. So this is going to be a little pinch. This hurts a little bit. I'm sorry. We're going to outline a little bit first. Here we're using Define because I really want to create structure for her. A little pinch. She really wants a shaping more so than too much volume. Again, a little pinch.
What do women in America look for in lips compared to in other countries?
Well, I don't know anymore because I see so many Instagrams with the women in America having these huge, huge, huge lips. I don't like that look as much. I like more subtle. What I'm trying to do with her is to get the border to be a little elevated so we're not volumizing her much. We're just going right into the border. One more. And here we're using Define. You can see, look, see much more shaping there. We're going to go to the other side. Define's nice because it's going to give a little structure. A little pinch, deep breath, at the border. Could even pinch the border a little bit. Do a little thread. Again, little pinch, we're going to go.
Right now on the lips, he's using Restylane and Define.
Because I want her to have a little more shape. Gotta do a teeny bit of volume, just a little. Sorry, I'm doing good. Take a breather. Okay, now we're gonna work just a little on the border. Very little.
They're saying her lips look great.
She's gonna be very happy. Obviously it gets a little swollen now. Let me see the other side, give me a breather. And then lastly, yeah, that's great. So getting a little more lift here in this midline, the cupid's bow. So right now she'll be swollen, and that'll go down. Now typically, okay. Now typically, we expect the swelling to go down 20 to 30% or so. Now I'm gonna do a teeny bit on the bottom. Just a little to just balance, because we want the lower to be just a little bit bigger than the upper, so not a huge difference, very small, only about 2.2, 2.3. And for her, deep breath, look all the way up a little, look at your chin, there you go. Swallow, nice. Little pinch. Just doing very little. One more. And then one thing we need to do is give support to the entire lip by working on this lower cutaneous lip area. So this is kind of around the chin.
Can you talk about why it's important to balance around the lip area?
Yeah, this perioral area really supports the lower face. It makes it so the jowls don't feel as tight. There's not as much sagging. Same thing goes for doing a little bit to the fold. So we're going to do a pinch to her fold. And her eyes, Rosa. You don't mind. Okay, I'm going to go to the other side. We should definitely ice her. Now she's going to get swollen a little bit. Hold on. So the upper lip, when you do the pillar technique, gets very swollen. But that will go down. Again, one more pinch, deep breath. We're just doing the whole perioral area to give support, because as you age, this whole area starts to kind of cave in and collapse. Okay, ice. Now I'm going to work on her nose. using a special technique. So I'm going to work on our nose using a special technique. We're going to do a little bit of a needle injection here, but on the tip itself, I want to use a little cannula. You're going to feel one little pinch, deep breath, 1, 2, 3. This will do, close your eyes. This will make it a little bit safer for her because this area tends to, we're going to do a little pinch, go ahead. Deep breath in, all the way out, good. That's right, keep breathing. This is going to give support now to the septum of the nose, and you're going to see this tip rise. Here. We're using that lift, which has a little bit more of a lifting capacity. Okay. So you can see right now we've got that little tip elevation. You guys see? Now the question is, how much of a tip elevation do you want? Some people call this a Tinkerbell flip. I tend to like not having too much of it. I do a little bit more. Again, deep breath, 1, 2, 3. Good. Doing great. You can see if you look at all angles, you see that elevation now? Now what I'm going to do is finish that. So this part doesn't hurt nearly as much. A little pinch, 1, 2, 3. Actually, we're going to work on just elevating the tip cartilage here, right here. Second. I'm going to do a little blending on the bridge. Don't wipe your eyes, you guys. And it's always a little bit of a painful one. I want to do a little bit of blending on the bridge, very soft, just a small amount. The one thing a lot of people will do is they'll often overdo the filler up here, which makes this look really big and wider at the eye area. Sorry. I'm just going to do one more spot here. You need to camouflage a little bit of the bump.
Can you talk about the benefits of this technique you're using versus other kinds of nose filler?
Well, all different fillers act differently. This one is going to give us more support. So that's the reason I'm using it, very small. Alright, let me show her that because I want her to see. Obviously her lip here is swollen, but that will go down. I want to do a little pinch here. Will you guys show her at least her nose? I want her to see the nose before I make a decision if I want any more in there. I like her having a little bit of a slope. Take a look. What do you think on the nose?
Oh, wow. Oh, my goodness.
Obviously your lip is a little swollen, but I want you to see the nose. What do you think of the tip lift?
I think the tip looks great. I wanted a little bit more definition in here. Are you thinking about putting more up here in the bridge?
Well, I was going to put, I don't want to go too high. You don't want it to be too high. I was going to do maybe a teeny bit here, but the difference is if you put more here, then you lose the slope. And some people really like to have that slope.
Oh, so you can really see it on this side.
Yeah, so the question is, you know, do we want to kind of camouflage a little bit more? If we go too high,
will it make it look thinner if you put more in here?
No, it'll make it look wider.
Okay.
That's the thing, and I don't want to do that because I like the width. So I was figuring what I would do is just do a little bit more through here and maybe a tad right to the under eye to balance everything. And then we take a look at the nose in like a week, and if I want to add a teeny bit more, I can. Obviously there's swelling from needle injection. But what do you think of the tip? Look at it like on an angle. So lay back, and this is our Emer reveal. Now turn her onto the side so you can see the
It looks like a
elevation.
completely different profile.
Yeah, it's great.
It's exactly what I wanted.
Yeah, it's amazing.
I have a tip again.
I know, I love it. So they're asking why I don't aspirate. Go ahead and you can turn it back. The reason I don't aspirate is I've done this for a very long time and I know my planes. And it doesn't mean just that you aspirate that you'll have protection. And some of these fillers, for example, even like this one, tends to not be as easy. There we go. To balance the aspiration with anyways.
They're saying the nose looks amazing.
It looks great. So that technique I use is a very European technique, but it's safer than most techniques in the US, which are done with needles. I'm just using a little bit of the extra to balance some of the trough, to balance some of the apple of the cheek, and to balance some of the pre-gel area. Perfect. So now let's wipe her and show her the regular reveal. We'll raise her forward a little bit.
Oh wow. Oh wow.
You really do good with volume. You really do. You guys wouldn't think, but volume makes a big difference. I'm gonna clean you because then it's easier to see everything. Volume makes a big difference, and the thing is, her lips are going to be swollen because we did a lot on the border. That will settle down, but overall, like nose. Now we
See
have.
how you can see the definition of my bone?
I know.
I mean, the backstory is this was the result of a bad first surgery where he shaved it down too much
Got it.
and made it look masculine.
Got it.
So when you put filler in the nose, it gives the illusion of,
Right,
of,
making
a,
it
of, a, of a
slim.
point,
Yeah,
that is
exactly.
slim.
Which is why I don't want to overdo the amount of filler here, because you could put a little bit more filler right here to balance out the top, but then what happens, you guys, if you look to the side, then it straightens this whole thing and she loses the slope. So I'd rather leave it, let the swelling go down, but keep the nose tip elevated. Also balances really well. The high elevation of her tip really balances well with the high cheekbones, the softening of her tear trough, more definition of lips, and then also the chin coming forward. So that's full facial sculpting, guys.
Wow.
Nose, cheek, trough, chin. Overall facial balancing. Doesn't even look like she had anything done. We call it the without a trace lift because she's gonna walk out of here without a trace, right? It's really
That's
good.
right.
Yeah, it's
Did a great
amazing.
job.
All right, so off to the races. Now she rests, and we'll see her in a few weeks. Bye.
Bye guys, thanks for watching.
I'm gonna look at you from far. Yeah, it's great.
Ugh.
You look so much better in your cheeks. It's crazy.
I know.
Your cheeks and your chin.
Because you
Go
see,
download
my
it.
face is so round, okay? So
Now
when
you don't have that.